Okay, so let's review the entire process. This is the radiographic guide process. If you use it on every patient, you'll be able to get a surgical guide. The stone model and the DICOM only, you may not be able to use on every patient. So basically, if you take a VPS PVS impression, you send it to us or a dental lab, and they build a radiographic guide. Then you scan the patient with that dual scan technique. We go through a treatment plan and send out a surgical guide. So it's pretty straightforward. There's not a lot of steps to it. Basic rules of using the guide, though, if you don't want to use a radiographic guide, and that's dentition supported. If you don't have a lot of noise, then it's, I would do the stone model route, but a radiographic guide is recommended, but again, not always needed. If it's tissue supported, then you want to get a radiographic guide, especially for the restorative aspect. And bone supported, you don't really need a guide. In some cases, it's recommended, but if you're just going to do a bone supported guide, whether you use a bone reduction guide or you just use the natural bone, you don't really need a guide for that case. So this is something we've had a lot of requests for some type of book or manual. So this is a book that we've made, and it goes over the first couple of chapters. Will go over how to use the Blue Sky software program to just a few clicks, and you can have a patient presentation really professional, and you can show them the 3D view, and you don't have to learn the software. Just step by step, it shows you how to do that. And then a basic placing a virtual implant. It won't go over for those of you who've treatment planned with me, you'll know that as we're planning the implants, I'm clicking a million different things and changing transparencies, and I do a lot of stuff. This will go over the basics. It won't go over the advanced stuff that I do. And the rest of the book really is just a written information about what I've covered tonight in this lecture. And then it goes over details in immediate temporization, radiographic guide fabrication, and then some didactic stuff. And then we have a pretty extensive glossary at the end. So if you're interested in this, let me know. Right now we've had a lot of requests, so it's on back order. But if you do want one, let us know. We'll put you on a list. They're $50, so they're pretty nice. Okay, so as I said in the beginning, we don't do just this guide. There's definitely support behind that. And you can have full support where you never touch your computer and we treat and plan the whole case with you guys. Or you have limited support where those who like computers and it's more efficient for you to do it on your own, then we support you with that as well. You have the software and the computer treat plan that way. So you could do, either way. So our basic process, what we do for you guys, is we do your data conversion, and then we have our 1 hour software support. You can use it or not. Usually doesn't take any more than an hour to go through. And then we have these surgical and restorative reports, and then we fabricate your surgical guide. And we do it all instead of charging per implant. Because it's a process, we don't focus on the guide, we focus on the entire process. And so we just do a flat rate for that. And then we do have, if you want everything except for the surgical guide, we have a setup for that as well, just for the consulting aspect of it. And so I want to thank you guys all for coming out again tonight. I really appreciate it. I hope that this was staying with those basic fundamentals for all of your different cases. If you have a case coming up, don't hesitate to call. We can kind of discuss what's the best method and how to approach it and get started on it. My number, you can reach me directly at 760-274-4080. Or you can email me. I'm pretty good at returning those as well. It's info@informationdental.com. So I'm going to turn it back to Michael. If you guys have any questions, let me know. We'll field some questions.